5 more flu-related deaths are reported in San Diego County, bringing the flu season toll to 11. The victims range between the ages of 44 to 91, with 4 of them having underlying medical conditions. The County Health and Human Services Agency say that the rate of infection will continue to increase. 838 confirmed cases were reported last week, and that was up more than 200 cases from the week before.
Well, despite the recent climb in flu-related deaths, though, cases being reported, California as a whole is still well below the number of cases reported in recent years.
Here to talk more about the flu season of 2016 is Dr. Susan Heifetz of Tri-City Medical Center. Thank you so much for joining us.
Hello, thank you so much for having me.
I'm glad that none of us are experiencing any flu symptoms at the moment,
Yes.
but let's talk about those out there who may be suffering right now. I think a lot of people confuse a common cold with the flu. Can you kind of break that down and give us the difference?
Sure. Many of the symptoms of the flu overlap with a common cold. Cough and sore throat are symptoms, but with the flu you often get high fever and body aches and fatigue that's very, very bad, and you can have a cough and shortness of breath in some cases, and occasionally diarrhea can be associated with the flu.
There are a lot of viewers out there going, wait a minute, we're entering March. Aren't we done talking about the flu? But we're just gearing up.
It's just getting started here in San Diego County. For the last 3 weeks, we've been seeing increasing numbers of flu reported within the past. During this flu season, we've seen 2,628 cases of the flu in San Diego County. There have been 11 deaths, and the number of deaths each week is increasing right now. So it's very important for everyone to get their flu shot as soon as possible. The flu season began a little bit later this year compared to last year, and so the numbers don't reflect the full impact of the season yet.
That's why the numbers statewide are probably down. We just haven't gotten there yet to some of the numbers.
That's correct, and the numbers are going up. So, and the typical flu season lasts for 13 weeks, and we are into this one about 3 or 4 weeks in now.
Wow.
So
David gets his flu shot every flu season. I have never had one. I know. Let's talk about the pros and cons of the flu shot.
Sure. Well, I highly recommend that you get the flu shot every year, and really everyone should be, with a few exceptions, certain individuals with egg allergies, but many of them, if they're over age 18, there is a flu vaccine that is safe for them, the recombinant flu vaccine. But generally, it is important for all people beginning age 6 months and until their elderly years to get an annual flu vaccine, and those that it's extremely important for are our babies and young children and elderly patients and pregnant women, because they are the ones who are most at risk for having complications from the flu, hospitalization, or even death. So, and it's very important to seek medical attention as soon as you think you might have the flu, because there is a treatment available that can shorten the duration of your symptoms and also reduce the likelihood that you'll be hospitalized and make your symptoms a little bit less severe. And so, but it's best if it started within the first 2 days of symptoms.
If people don't have a regular doctor, where can they go to the county health? There are county health clinics and get the flu shot?
Yes, and also many of the pharmacies in the community offer flu vaccines. I called a few of them this morning to see what they were charging, even if many times health insurance will cover the flu vaccine. But if they don't, the prices range around $29, $31 from the places I called.
They do sell out quickly, though. In my defense, I did go to my neighborhood CVS 3 times and asked about the flu shot, and they were sold out.
Really?
Yeah.
Wow.
Well, they had a shortage a few years ago, but that's not the case anymore, right? They're in normal circumstances.
I haven't heard of any shortages in the area.
Except for her CVS.
Yeah, that's
apparently.
it.
Except for, and exactly.
You must have ordered a small.
Well, Doctor, thank you so much for coming on.
You're welcome.
Refreshing
it's
our
my
memories.
pleasure.
To go out
Sure.
and get a flu shot.
Thank you.